My name is Dr. Geeta Sinha. I am from the Department of Anatomy and Neurobiology. This is the fourth presentation of the Head and Neck series. In this presentation, I will be talking about the triangles of the neck. On the first part, I will demonstrate the boundaries and the contents of the anterior triangle, and in the second part, I will be demonstrating the boundaries and the contents of the posterior triangle. Now I am going to demonstrate the different triangles of the neck. The anterolateral region of the neck is divided into two main triangles, the anterior triangle and the posterior triangle. So now let's look into the margins of the anterior triangle. This is the midline, this black line coming from the chin all the way to suprasternal notch. We take this lower border of the mandible, and this line is representing the anterior border of the sternocleidomastoid muscle. This area is your anterior triangle of the neck. This is the base of the triangle. This is the apex of the triangle. The triangle is subdivided into four smaller triangles. They are your submental triangle, the submandibular triangle, also known as digastric triangle, carotid triangle, and muscular triangle. Out of these four triangles, the carotid triangle and the submandibular triangle are more of the clinical importance. Let's look at the different boundaries of these triangles. This area here is the body of the hyoid bone in the greater cornu of the hyoid bones. So that's this area here represent the superior belly of omohyoid. So the triangle between the sternocleidomastoid muscle, midline, and the superior belly of the omohyoid, this yellow triangle is your muscular triangle, and it contains the strap muscles. The area between the superior belly of the omohyoid, posterior belly of the digastric, and the sternocleidomastoid, this triangle, the base of the triangle and the apex of the triangle. This red area represents the carotid triangle and the most important region on the neck. Looking in here, the green area, which is bounded by the lower border of the mandible, posterior belly of digastric, and this black line is the anterior belly of the digastric. This is your digastric triangle, or this also known as submandibular triangle because it contains the submandibular gland. We look just underneath the chin, bounded by the midline, the anterior belly of digastric, and the hyoid bone. This triangle in the blue is your submental triangle. Now let's look into the posterior triangle. The posterior triangle is bounded by the posterior border of the sternocleidomastoid muscle, the middle third of the clavicle, and superior border of the trapezius muscle. You can see this is the base of the triangle, and this is the apex of the triangle. The posterior triangle is again subdivided into two smaller triangles. This area here is the omohyoid muscle. So between the clavicle, omohyoid, and the posterior border of the sternocleidomastoid, this is your supraclavicular triangle, a small triangle here. And this triangle, which is lying on the posterior aspect, is the occipital triangle. So now we are going to go to a prosection to see the contents of these triangles. We are looking at the anterolateral region of the neck. This is your lower border of the mandible, midline, and this is your clavicle here. So now we reflect the skin from the anterolateral region of the side of the neck. What we are looking here is this is the platysma muscle, and I'm going to reflect the platysma upwards towards the face. Let's define the boundaries of the anterior triangle. First, we look at this structure here. This is your mastoid process in the back. This is your sternocleidomastoid muscle, which divides this anterolateral region into two triangles. Anterior to this is anterior triangle, and posterior to that is posterior triangle. The boundaries of the anterior triangle is the midline, the inferior border of the mandible, and anterior border of the sternocleidomastoid. So we can see this is the base of the triangle, and this is the apex of the triangle here at this point. This triangle is subdivided into 4 smaller triangles. The submandibular triangle, or also known as digastric triangle, carotid triangle, muscular triangle, and submandibular triangle. Let me start with the submandibular triangle. The boundaries of the submandibular triangle is formed by the anterior belly of digastric. Now I'm holding the anterior belly of digastric. Lower or inferior border of the mandible forms the base, and if I remove this gland here, we can see this is the posterior boundary, which is formed by the posterior belly of digastric. So the posterior belly of digastric, there is the intermediate tendon of the muscle, which is attached by a fascial hook to the hyoid bone, and then we see the posterior anterior belly of the digastric. So this is the apex of the triangle here, and this is the base of the triangle. Contents of the triangle. This triangle contains submandibular gland. We are also looking here this structure, which is going towards the mandible, and that is your facial artery. Posterior to that, here is the part of the facial vein. Also in this triangle, another important structure which we see is coming down. This is your hypoglossal nerve, which is the 12th cranial nerve, and it enters the mouth cavity through the piercing between the mylohyoid muscle and the hyoglossus muscle. So there we can see the hypoglossal nerve. One important thing is the hypoglossal nerves runs from the posterior to anterior in the same direction as the posterior belly of digastric. So now you can see this is the posterior belly of digastric, and just running parallel to that is your hypoglossal nerve, the 12th cranial nerve. Let's look into the boundaries of the carotid triangle, and we look into the contents of the carotid triangle. Anteriorly, the boundary is formed by the superior belly of omohyoid. This muscle, which I'm picking right now, is your omohyoid muscle. This is the superior belly. We look at the anterior border of the sternocleidomastoid muscle, and here we see the posterior belly of digastric. So the triangle is formed, this is the apex of the triangle formed by these three structures. This is clinically a very important triangle. It contains the common carotid artery dividing into external and internal carotid artery and the branches of the external carotid artery, vagus nerve, and the internal jugular vein lying into the carotid sheath. So let's reflect the sternocleidomastoid muscle. Starting from lateral to medial, this structure which we are looking at right now, I'm holding by the probe, is your internal jugular vein. Lying on the medial aspect of the internal jugular vein is your common carotid artery. This, at the level of the hyoid bone, divides into two terminal branches. Lying more medially, this is your external carotid artery because it goes towards the face, and lying on the posterolateral aspect is your internal carotid artery. In between the internal jugular vein and the common carotid artery, we see a nerve which is running parallel to it, and that is your vagus nerve, the 10th cranial nerve. When you are dissecting it, these three structures are enclosed into a thick sheath which is known as carotid sheath. Let's look at the internal jugular vein. Internal jugular vein, on the surface of that you see a loop. This is known as ansa cervicalis. Ansa in the Latin is known as loop, and this is formed by the cervical nerve C1, C2 and C3. This is the superior root and this is the inferior root of ansa. The superior root is formed by the C1 fibers and the inferior root is formed by C2 and C3 fibers. They join together and then they go into the strap muscles, supplying the strap muscles in the muscular triangle, and you can see here the branches going into these muscles, which are sternothyroid, sternohyoid muscles, and that is supplied, as well as omohyoid, supplied by the ansa cervicalis. Now I am going to look into the branches of the external carotid artery. The external carotid artery, the first branch which is given by this is your superior thyroid artery. The second branch which I am holding right now, this is the lingual artery. The structure which I am holding in my probe, which is lying deeper to the external carotid artery, this is your internal laryngeal nerve. And the internal laryngeal nerve is a branch of the superior laryngeal nerve, and it comes to pierce the thyroid membrane to enter inside the larynx, where it will supply the mucosa above the true vocal cord. There is an artery which runs with this, is the superior laryngeal artery, which is a branch of the superior thyroid artery, but that artery is missing in this prosection. Now I am going deeper to the common carotid artery, and now I am holding this structure. This is your sympathetic chain. So this is the superior part of the sympathetic chain, and I'm not going to able to show you the superior, middle, or inferior ganglion on that. But this is the chain runs into the cervical region or in the neck all the way up to the superior cervical ganglion. Going on the superior aspect of the triangle, parallel to the posterior belly of the digastric, which is forming your boundary, we see a structure. This is your hypoglossal nerve, which I already talked about in the submandibular triangle. But you can see the nerve crosses the external carotid artery. That's an important landmark to identify this nerve. That concludes the demonstration of the contents of the carotid triangle. Now let me demonstrate the boundaries and the contents of submental triangle. This is a very small triangle, and which is defined by the anterior belly of digastric muscle. Here is the anterior belly of digastric, the hyoid bone, and the midline. So now you can see this triangle, which is lying just under the chin, which is the mentum. So that's the name. It gets its name, the submental triangle. What I'm pointing out right now is the mylohyoid muscle, and this forms the floor of the mouth. In the content of this triangle is the submental lymph nodes. Now these lymph nodes drain the area of the lower lip and the tip of the tongue, and especially in the case of the carcinoma of the tip of the tongue, the enlargement of these lymph nodes helps to staging of the cancer. Let me demonstrate the boundaries of the muscular triangle. The base of this triangle is formed here by the midline, and the omohyoid muscle is superior belly of the omohyoid is coming on this side, and then the lower part of the anterior border of the sternocleidomastoid, which we can see here where they are meeting. This is the apex of the triangle, and this is the base of the triangle. Let's look in the contents of the triangle. The muscular, as the name suggests, contains 4 ribbon-like muscles or strap muscles. This muscle which I am holding is your sternohyoid muscle. This muscle which we are looking at right now, this is a sternothyroid muscle, and very small portion which I am looking in between the omohyoid and the sternothyroid, this is your thyroid muscle. We can also see part of ansa coming to these lower part of these strap muscles. So that finishes the demonstration of the muscular triangle and its contents, the strap muscle. So now let me take you to the posterior triangle, and we are going to look at the boundaries and the contents of the posterior triangle. So I am removing the platysma back again, reflecting upwards. There is the mastoid process, suprasternal notch. This is your sternocleidomastoid muscle coming diagonally to attach into the sternum and the clavicle, and we are going to reflect this. Let's look into the boundaries before I reflect this. So the posterior boundary of the sternocleidomastoid, middle part of the clavicle here, middle third of the clavicle, which is sort of shown in here, and this in the back here, which I'm holding right now with my probe, is the superior border of the trapezius muscle. So this triangle here which is the apex is lying at this point, is your posterior triangle. The structure which is I'm holding right now is this is external jugular vein, which lies on the surface of the sternocleidomastoid muscle. Now I'm going to reflect the sternocleidomastoid and look at through two subdivisions of this triangle. There we are going to see the belly of the omohyoid. So this small triangle which we are looking here, formed by the clavicle, posteriorly by the omohyoid muscle and the posterior border of the sternocleidomastoid. This triangle here is the supraclavicular triangle of the posterior triangle. Let's look at the floor of this posterior triangle. The muscle which I am pointing here is your scalenus anterior muscle. Second muscle which I am pointing here is your scalenus medius muscle. These fibers which I'm pointing these are the levator scapulae muscle, and up on the top here is the splenius capitis. So these four muscles form the floor of the posterior triangle. Now, the structure I'm holding, which is lying onto the surface of the scalenus anterior muscle, this is your phrenic nerve. The phrenic nerve is plastered to the fascia of the scalenus anterior muscle. This is coming from the ventral rami of C3, C4, and C5, and this supplies the diaphragm. Between the scalenus anterior and the medius, we can see the root of the brachial plexus coming out. So in this area here, you can see the C5 root, C5, C6, C7, and C8 roots of the brachial plexus. Posterior to that is scalenus medius muscle. So on this view, I'm going to show you the two important structures which are in the posterior triangle, that is your phrenic nerve and the accessory nerve. So first I'm going to show you the accessory nerve, which is the 11th cranial nerve. So now this is the platysma. I'm going to reflect the platysma up, and there is the sternocleidomastoid muscle. I'm going to reflect upwards. And now we are looking here, this nerve. This is your spinal accessory nerve, which is the 11th cranial nerve. This gives innervation to two muscles, the sternocleidomastoid muscle. You can see the fibers coming into the muscle, and after supplying this, it passes through the floor of the posterior triangle to enter in the trapezius muscle, which it supplies. So this is your 11th cranial nerve, the accessory nerve, or it's also known as spinal accessory, which is an important content of this posterior triangle. And again, I'm just reviewing the phrenic nerve, which is coming from the C3, C4, C5, which keeps the diaphragm alive, is lying over the scalenus anterior muscle. Now I'm pointing to the scalenus anterior muscle. You can also see the root of the brachial plexus coming down between the scalenus anterior and scalenus medius. We also see another structure here, which is this artery, which is crossing the floor of the posterior triangle, and this is your transverse cervical artery. So that finishes the demonstration of the posterior triangle.